Well, every year, heart failure impacts roughly 6.5 million Americans. The good news is for those who find themselves in this situation, Bon Secours has some great treatment options for you. We have upstate cardiologist Dr. Jeff Sinfield here to tell us more about it. Dr. Sinfield, always good to see you.
Always great to see you. Thanks for having me.
Yeah, so let's,
Yes.
when I hear about heart failure, it seems kind of broad yet
Yes.
specific at the same time. How do you, what does that term mean?
Well, the general idea about heart failure is basically the heart is a pump, correct?
Right.
And so it's when that pump can't keep up with the body's workload. So that means you can't deliver blood, which carries oxygen as well to the body's tissues or the body's organs. And thereby, patients will develop symptoms such as shortness of breath or chest pain because we're just not delivering blood to the organs as well as we should.
So it seems like heart failure is up here, and then you have other different things like down here that are impacted because of heart failure.
Yes, and so it leads to downstream events. It can lead to problems with the kidneys. It can lead to problems with processing fluids in the body. So it's not uncommon to see patients who have heart failure with swelling in their legs, kind of puffy, or even that fluid could go into their lungs, which it's basically causing the patient to drown in their own body fluids, which can be very dangerous.
Yeah, very serious.
What gets us to that point where you're like, ooh, like is heart failure just like boom when it quit working, or is it like a slow kind of?
For most patients, it's a gradual process that takes years and years and years of this process from occurring. So the heart, when you start to develop heart failure, it can dilate and it can weaken. So we talk about the term ejection fraction, which is a measure of the squeeze of the heart. So a normal squeeze, a normal ejection fraction is about 55 to 60% or within that window. But it's when that number starts to drop slowly over a long period of time and you get down into the 30-35% range or lower, where it becomes very severe and the symptoms can become very severe.
And the treatments have come a long way over time too. Technology has advanced. Talk about some of the things that you guys are doing at Bon Secours to kind of help folks through this.
Well, it starts with patient education. That's the first thing you have to do. So avoiding high salt containing foods like canned soups or fried foods, things like that. But we always want to start patients on what we call medical therapy. So there are at least 3 to 4 drugs out there that we can give to patients to help strengthen the heart and to help stabilize their symptoms. But when those drugs fail or they don't give patients the sustenance of life that they would like, there are other invasive options and therapies we can provide. And one of those therapies we've been instituting in our hospital system recently is a device called the CCM device.
Ooh, what is that? That's tiny.
Yeah, it's a tiny little device. So we don't just hand it to the patient and say, have a good day.
Yeah, here you go, good luck. No more salt.
Figure it out,
no more salt for you.
Yeah, so it's actually a device where we implant it underneath the skin.
Oh.
So a lot of devices like these are called pacemakers or defibrillators, and for certain patients, they're candidates for these devices as well. But for patients, despite all the therapies we've provided and their heart failure symptoms are still very severe, they're a candidate for this device. So basically, we can implant it on either the right or the left side of the chest, right or left side of the chest, and there's leads connected to it, just like a pacemaker, but they don't pace the heart. It's a new concept. And so CCM is the name of the therapy, and it stands for cardiac contractility modulation. So basically, what it does is it infuses a high amount of voltage into the heart to kind of wake up those heart muscle cells that aren't beating so well. So for patients who, can't even walk to their mailbox or they're bedridden from their heart failure because they're so sick from their heart failure, this can kind of infuse more energy into the heart and thereby making them feel much better. We just had a few patients I saw in the office recently that this gentleman, like I just mentioned, couldn't even walk to the mailbox. Now he's going to the grocery store. He's just danced with his wife for the first time at a party. So this is the ability to give patients back the life that they might have not had.
That's not, Matt, like you take it for granted.
You do.
Dancing with your wife
take
is
it
not
for
something you
granted.
put on like the top. You like something that you just take for granted, right?
And a lot of times in medicine, we talk about the quantity of life, right? Increasing the lifespan of a patient. But what about not only doing that, but giving them back their quality of life?
And it's amazing about something that small can do that too. And of course, all month long with Heart Month, we've been encouraging people to adopt a better lifestyle and watching what you're eating, getting rest, all of that stuff plays a role.
That all starts with that. So we can't be successful unless we eat the right things and get appropriate exercise if we can, and if you're prescribed medicines, taking the medicines that are prescribed to you at the right time each day. So it all comes together, and all these therapies are additive, all right? So we just don't give one or two and hope for the best. We want all these things to work together to give the patient the best possible outcome.
I love the segment. You make it very simple. It's a complicated thing, but you make it sound so great. Great job, Bon Secours, for really keeping us up to date on all the new technology.
Reach out to Upstate Cardiology if they can provide some services to you. Thank you.
We're always happy to.
Yeah.
Thank you so much.
Thank you so much.
Thank you so much.